Hello, and welcome to this month's session of Simon Says Expert Series. My name is MacKenzie Church, and I serve as the Executive Director of In Lung Cancer Now. In Lung Cancer Now is an initiative at the IU Simon Comprehensive Cancer Center that was founded in 2020 by Dr. Nasser Hanna. We are integrated within the Cancer Center's Office of Community Outreach and Engagement, and we are fully funded through philanthropy. In my role, I lead strategic planning and implementation, stakeholder engagement, and capacity building for our team. In Lung Cancer Now's vision is to end the suffering and death from lung cancer here in Indiana, and our mission is to educate and empower community advocates to help us eliminate tobacco use in Indiana, screen all eligible Hoosiers with low-dose CT scans, increase participation in lung cancer research, and build a network of advocates to support lung cancer survivors and their caregivers. We have 6 core values that drive our work: accountability, doing what we say that we'll do; inclusivity, integrity; partnership, which is really the foundation in all that we do; passion and joyfulness; and promise to patients that we'll get the job done. November is Lung Cancer Awareness Month, and we're excited to be here with all of you today and share with you the work that's taking place to achieve our vision of ending lung cancer now. Joining me today is Dr. Nasser Hanna, the founder and chair of In Lung Cancer Now. He is also the Tom and Julie Wood Family Foundation Professor of Lung Cancer Clinical Research and a Professor of Medicine at the IU School of Medicine. And he was also recently appointed the Chief of Cancer Screenings for IU Health. Thank you, Dr. Hanna, for joining me today.
Thanks, MacKenzie. I've been really looking forward to this. This is an area and a topic that I am so passionate about, and I know you share my passion, and hopefully we'll be able to give some insights into why we think this is a special cause and a special organization, and I just look forward to the conversation ahead.
Absolutely. And to kick off the conversation, can you just answer, how did all of this start?
Yeah, well, years ago when I started seeing people with lung cancer, it was challenging to find better therapies, and a lot of people were suffering. A lot of people were losing their lives prematurely from this terrible, terrible disease. And I wanted to do something that I thought that could help prevent and help advocate for patients, and just to do something that could possibly make a difference on another level. So about, 20 years ago, my wife and I started a non-for-profit. We had no idea what we were doing. We just decided that we're going to do something, that it's our responsibility to do something. So we Googled 501c3 and what it takes to be a non-for-profit, and we named our organization the first thing that we could think of, which was Lungs for Life. And we started doing advocacy work and raising some money. And then we got a little bit deeper into it and rebranded ourselves Cancer-Free Lungs, because your organization should really say what it's trying to accomplish. And so we got a lot more savvy. We did a lot more community engagement. We raised a lot more money. And then my wife and I started a tobacco education program for kids, and we took this around the state, and we educated tens of thousands of kids throughout the state of Indiana on the dangers of cigarettes and so forth. And we did this for about 7 or 8 years, and then life just continued to happen. Our family grew. We had our 3rd child, and we decided that we had put so much into it, but we needed to focus on raising our family and so forth. So years had gone by. The passion was still in me. The fire still burned very deep, very bright. And I thought at some point I would certainly come back to this. As the years went, I did everything I could to advocate for smoke-free workplaces, to increase tobacco taxes, to educate, to empower. And then about 4.5 years ago, Amber Sensony, the head of our gift development office, came to me and said that we have a little bit of startup money for patient services. And is there something that you can think of that we can do with this $40,000 yearly for 2 years for a total of $80,000. And about an hour later, I wrote her a very exhaustive email because all of this really had been inside me all these years. And the first thing I knew is I knew what I wanted to do. And I knew from my prior experience, you want to start an organization that says exactly what you mean to do. So I named the organization in that email, and that was End Lung Cancer Now. And the most important of those 4 words is the last word. It's now. It gives a sense of urgency to stop the suffering and stop all of the hardship that this disease, because this disease used to be rare. And so I wanted to end lung cancer now. And I knew what the vision was. The vision is the dream. And the dream is to end the suffering and death from lung cancer in the state of Indiana, my adopted state. I'm from Missouri, but my wife and I came here in 1998 to do my oncology training. And I fell in love with the state of Indiana. And I think after being here for 25 years, you're officially a Hoosier. So this is my adopted state, and I want to do everything I can. And so we started the organization, and that's where the impetus came, and the magic just flowed from there. So I think for all of this, it really comes down to what makes us tick. And what makes me tick is service. It's the sense that I'm doing something to help somebody else. It gives me purpose. And there's very little that I can find outside of family and faith that gives me more purpose than public health. Doing the greatest amount of good for the greatest amount of people. So I know that public health is very important to you, MacKenzie, and I know you're wrapping up your master's program in public health. Can you reflect on why you decided to pursue that degree and how that's been incorporated into your work with End Lung Cancer Now?
Yeah, absolutely. So I grew up in a small town about 30 minutes south of downtown Indianapolis, Franklin, Indiana, in Johnson County. And growing up, most of the adults I knew either worked in the school system or had farms or worked in the factories or any other blue collar job. I am also the first in my immediate family to graduate from a 4-year program in college, and also became a mom at a very young age. So for me, education, access to quality healthcare, access to resources, that network of support really has what has enabled and empowered me to get to where I am today. So through that personal experience, I've always been driven, like you, to do something for the greater good. We're all here for a bigger purpose. And so I am driven by a mission. So I started out in nonprofit, did event planning, worked at the National MS Society, did fundraising events for them. And that's really when I was exposed to kind of the healthcare side of nonprofit. And then I transitioned to a position at IU in the continuing medical education department, and kind of was able to pull in that education side to healthcare. So then I was still in that role when I decided to pursue my master's in public health, and I'm focusing on health policy and management. I am a relationship builder, but I also wanted to understand how I could contribute to improving quality of life for those around me, not only through community building and sharing information, but also really looking at the health system and addressing some barriers that exist. I know that I was fortunate to have access to options and resources, but I know that's not true for everyone. So I wanted to make sure education and building my skills to address some of those things. And also, like many others in our state, my family has been impacted by cancer in multiple ways. So the field of public health, this role here at End Lung Cancer Now really pulls together all of my passions and really is what motivates me every day to do what we do. And when thinking about lung cancer in the context of public health, it is a public health issue, in my opinion. And I personally believe that one of the biggest challenges has been really lack of awareness around lung cancer, around prevention, around screening. Thousands of Hoosiers are diagnosed with lung cancer every year, yet there's still a significant lack of awareness about how we can prevent it, about how we can find it early, how there are advanced treatment options, and ultimately hope for any patient who might be diagnosed with lung cancer. Before I started in this role, I didn't know about lung cancer screening. I didn't know really anything that I know today 3 years ago. So for In Lung Cancer Now, it's really been mission critical to meet the community where they are to share this information. Many of those who are at higher risk for lung cancer don't really engage with the health system on a regular basis. And so in order to empower them to become advocates for themselves, but also their loved ones, we must go to where they are. So as a team, we have done lots of different things in order to raise awareness and provide resources and provide education about our 4 main mission pillars. So we always focus on the importance of prevention, screening, research, and advocacy. We go to community health fairs like the Indiana Black Expo and the Indiana Latino Expo. We go to churches to give smaller presentations and really connect with people one-on-one. We visit low-income housing communities. We go to veterans coffee clubs, again, meeting people where they are, showing up and being able to talk in a language that they understand. I think that's very important when we're talking about healthcare, to make sure we're speaking in a way that really resonates with the community that we're talking to. So based on our experiences in the community and all that we've done and all that we've talked to, we've heard from many people that when we say lung cancer or we talk about prevention, people typically always think about smoking. And that in itself creates a stigma and a shame around a lung cancer diagnosis. So we try to always reiterate that anyone with lungs can get lung cancer. So when we say that, Dr. Hanna, can you elaborate a bit more on what that means and what other risk factors exist that people should be aware of and thinking about?
Yeah, no, I'd be happy to, and thank you for sharing all of that. And before I do that, I just want to reflect a little bit in how you're building teams, and it's so important to do this as a team and to show the leadership and the vision and the planning and really helping people all move in the same direction. And I interfaced with you first when you worked for the CME office, and we were doing the ASCO review together. And I got a sense at that time that you really got things done, that you were cool under pressure, and that you could really multitask, and you had very great leadership qualities. So we've been very lucky to have you leading End Lung Cancer Now. You talked about the values of End Lung Cancer Now, the accountability and the honesty and the trustworthiness and the promise to patients and so forth. And we have sort of said, well, those are the formal values, but we have 3 additional values, and that's guts, grit, and grace. And it's really about the guts to take on something that's really, really difficult. It's the grit to see it through, because difficult things are not easy. And it's to do it with grace so that we can be proud of the work that we've done and so that we can bring others along. And so I think you really have a wonderful leadership style and embody those spirits of grit, guts, and grace. I do want to address your question about the stigma, the guilt, and the shame. So people with a diagnosis of lung cancer unfairly have carried this stigma. All cancers have modifiable risk factors, all cancers. But lung cancer is uniquely singled out. And for this reason, people say, well, you got lung cancer, but, you're to blame for it, or it's your own fault, or you could have prevented it. And this really is very damaging, a very damaging thought process. No one deserves lung cancer. It's a terrible disease, and no one deserves lung cancer. And secondly, when we stigmatize in this way, there's less advocacy, and people don't self-advocate, and there are fewer resources for support and for funding, and people are less likely to get screened, and people are less likely to feel supported through an addiction to nicotine. And we really need to support people who need help. And it's the exact opposite instinct. And so I think it's so important to address that head on. I also think that most people who smoke don't get lung cancer. You stack risk factors on top of one another. Smoking itself oftentimes doesn't result in people getting lung cancer. 85% of people who smoke don't get lung cancer. 6 out of 7 people don't get lung cancer. So it's like having high blood pressure. Not everybody with high blood pressure has a stroke, but some do. It's a risk factor. Not everybody with diabetes has a heart attack. It's a risk factor, and some do and some don't, but you stack the risk factors. Smoking is a risk factor. You couple it with workplace exposures, such as factory work, pipe fitters, people who work on brake pads, people who work in coal mines, people who work on shipyards, people who work in a construction zone, welders, firefighters, people who work underground where radon levels are very high. Radon is a radioactive substance. It's the breakdown of uranium, and it's deep in the soil. Indiana has moderate to high radon levels throughout the state, and 1 out of 3 Hoosiers live in homes with dangerously high radon levels. You're exposed to that radioactivity all the time that you're at home. And Indiana, like every state, does not mandate that we mitigate high radon levels, or frankly, that there's even disclosure that you're moving into a home or an apartment or a workplace in which there's high radon. Air pollution is a risk factor for lung cancer. Indiana's air needs to be cleaner. And not all counties in Indiana have the same level of clean or polluted air. Where I live in Hamilton County, our air quality is actually quite good. But in Marion County, the air quality is not good. And the American Lung Association gives Marion County an F grading for air quality. Indiana pumps 4 times the number of industrial toxins into our air than the national average. Hoosiers are inhaling these industrial toxins. It's disproportionately in poor areas of the state where people already have disadvantages. They may have other what we call social determinants of health. Perhaps they're underinsured, they're uninsured, they have poor access to care, they get less screening, fewer interventions for prevention, less medical literacy, fewer resources. So the notion that we stigmatize a group of people because they smoked is cruel, and it's inhumane, and it's counterproductive. I'll just give you one example of that. When you underfund lung cancer research, you underfund research for cancer. Because when you study lung cancer, you study cancer. You understand so much about cancer just by studying lung cancer. So we've got a lot of work to do. There are a lot of Hoosiers that are at risk for lung cancer. Our smoking rates are way too high, and our screening rates are way too low. Before we talk about screening, though, I do want to talk a little bit about what End Lung Cancer Now is doing regarding young smokers. And can you share a little bit about the We Can Be the First campaign?
Yeah, of course. We partnered, I think we launched this in 2022 in partnership with the community outreach and engagement team here at the Cancer Center and also the health and wellness promotion team at IU Indianapolis. I almost said IUPY, but IU Indianapolis. And we created a campaign. It ties in social media. We have a big wall. We go to health fairs at the campus center and we talk to students about helping us create the first tobacco-free generation. So we can be the first tobacco-free generation. We are targeting college students. Young adults are very passionate. They're very engaged. They stand up for what they believe in, and they're also advocates for their loved ones and maybe advocates for those in their families that do smoke. So talking with them about resources, the health and wellness promotion team does share quit kits for students who need them or want them. The COE team here, the community outreach and engagement team here, shares a lot of information about vaping, educational resources about vaping. Our Quit Now Indiana program that the Department of Health has. And we just have conversations with students in a comfortable setting. We're normally part of a larger event that has food and it's fun and there's a good atmosphere. So being able to talk about a touchy subject in some ways in a low stress environment of sorts has really been beneficial. We're hoping to expand this initiative to other campuses statewide over the next year or two. And just really excited to build up our student advocates. I think over the last 2 years, we've talked to more than 500 students. We've recruited more than 100 student advocates who now participate with In Lung Cancer Now, volunteer at our events, and also in addition to having the conversation about tobacco with them, we also provide information about the importance of screening, sharing with them eligibility criteria. And I can't tell you how many times we've talked to students who then identify someone in their family that is eligible for lung cancer screening. And they are so grateful to have this information. You can tell that they've never heard of it before. And so just being able to connect with students, share that information, and really have them help us. Again, that team word, we can't reach everyone on our own. And so being able to, again, educate and empower people in the community to help us spread the word is so important. And so We Can Be the First is a great initiative that we're doing. I'm excited to expand and go to other campuses. And again, coupling that smoking conversation with screening, I think has really been important for us and has opened a lot of doors. When we are at other community events, if you start with that smoking conversation, people tend to shut down. And so we have a phrase here internally that we use that we always say, lead with screening. Just talk about screening. We know that quitting is incredibly difficult. So let's just get screened. Let's start with getting screened if you're eligible. So with all of that, tying in the smoking with the screening, we did our second annual gathering in 2022, a couple years ago, and we decided, screening would be our focus for each of our annual event each year. We choose one of our mission pillars to focus on, and so we started with screening. We invited experts from around the country to talk about their screening programs, a mobile screening program, how one system is now screening, I think, 50% of their eligible population in Kentucky. So just really learning from the experts. And we learned there that it's not a one solution fits all when it comes to screening. So transitioning to our second pillar of screening, it's really not a one solution for everything. We really need to look at this from a lot of different angles. We need to look at systems-based changes. How can we enhance resources? How do we educate the community? And so after that gathering, we developed an In Lung Cancer Now lung cancer screening task force. And we met over a 6-month period, and we really developed the blueprint of how we can transform lung cancer screenings, not only here at IU, but this blueprint, we believe, can be used for any system or any organization that would like to reference this if they are interested in expanding their screening programs. And actually thinking about our blueprint and the playbook that we had at the gathering that outlined all of the key points at this year's gathering, I met with someone, or I talked with a nurse from Northwest Indiana who's been coming to our events, and she reiterated to me that the playbook and the plans that we were able to share with her kind of enabled her and her team to start expanding lung cancer screenings at their small clinic. And so that was just really motivating to hear. I think when we set out to do this, it felt very overwhelming in some ways. And where do we start? And there's just so much to do. So she said to me, her having the plan, that we did the work, we put the plan together, and just being able to use that has really empowered her team to move forward with transforming screenings up in Northwest Indiana. So that's exciting to hear. And I think for the people on this call, can you kind of talk through what some of those key elements are from the blueprint and the work that we've done and the work that we're doing and what that looks like today?
Yeah, sure. I'm excited and enthusiastic about this area because screening does save lives, and that's just the fact. And 1 out of 7 people who is eligible for lung cancer screening is going to get lung cancer during their lifetime. And the facts are very simple. If you're part of a lung cancer screening program, your cancer will probably be caught early. And if you're not, unfortunately, it will probably be caught late. And that's the difference. Lung cancer screening saves lives. And, Hoosiers are very good at getting their breast cancer screening and their colon cancer screening and their cervical cancer screening. But we're not good at getting our lung cancer screening. And it's been a challenge. But the good news is there's really an opportunity here to make a dramatic impact on lung cancer mortality. We have the solutions to reduce the suffering and death from lung cancer. We don't have to create the solutions. We have to implement the solutions. So I was very proud of this task force work. It resulted in an 85-page blueprint. It's an audacious plan, and we're implementing a lot of it. At the heart of this is a centralized structure. So you can't have silos. You can't have everybody just sort of doing their own thing and not working together. But you need to have uniform or unified oversight, a centralized structure, sort of a central hub in which people are looking at scans and they're evaluating scans and they're communicating with patients and they're coordinating care, they're coordinating scheduling, they're tracking metrics, they're establishing follow-up care, they're providing education, they're doing the shared decision-making. It's very complicated. And to have every little small ecosystem doing it independently is the reason why our lung cancer screening rates are so low. So having a centralized structure is the heart of our plan, and we are building that out. Having adequate resource allocation is so important. You can have all the plans in the world, but at the end of the day, you got to have people, you got to have systems that are actually invested in it. And this is so important to do. For too long, lung cancer has been under-resourced across the country, across systems and hospitals, across the government. It's been vastly under-resourced, and it's hard to make transformational change with shoestring budgets. So we are working, and I'm so proud that IU Health has stepped up and the Cancer Center and provided adequate resource allocation. You also need to do things within the electronic medical record because lung cancer screening requires that you meet certain eligibility criteria. It's different. For breast cancer screening, you just have to be 40. And for colon cancer screening, 45. But for lung cancer screening, you have to have had a certain smoking history. And if you quit, it has to be a certain number of years and so forth and so on. So this data has to be accurately captured in the electronic medical records so that alerts can be sent to patients and to healthcare professionals to stimulate a conversation, which would then result in ordering. You got to have comprehensive tobacco treatment programs. You got to resource those programs. You have to have a multidisciplinary group to review the nodule findings because you find a lot of things on these lung scans. You got to track your quality metrics to find out where you're succeeding and what your gaps are and how you improve. You have to have resources for underinsured and underinsured, so we don't just widen the disparities in care as we implement new technologies. You have to have education programs, community engagement programs, public health programs. And so these are the key components of this blueprint. It is a tremendous amount of work, but our team is already on it. And, we talk about the values and the mission and the vision, but, I'd like to just kind of talk about three other things that we talk about at End Lung Cancer Now. How do we sustain our momentum? How do we build momentum? How do we build teams and keep energy and enthusiasm? How do we keep moving forward? So one of the ways that we do it is we work joyfully, that it is joyful work to do public service and to do public health and to do public good. We also jokingly say we want to do cool stuff. So frankly, our events are cool. Our swag is cool. I think people think we're kind of cool. So anyway, I've never been a part of the cool kids, so it's cool. But all joking aside, joyfulness and doing cool things is part of it. But at the end of the day, we're committed to getting the job done. Yeah. That's the bottom line. It's great to be joyful. It's great to do fun things, but you gotta get results. And so a vision is great, leadership is great, a plan is great, but you got to execute. And I'm really proud of this organization because I do think that we are executing. So how do we execute? How do we amplify our message? We do it through advocates. Advocates have saved more lives than medical science has. It's all about advocacy. Can you tell us a little bit about Advocacy and End Lung Cancer Now and a toolkit that I believe we developed recently?
Yeah, absolutely. So advocates, like you said, really are the heart and soul of our work. We put the plan together, but we need people to amplify our message, be out in the communities, make connections. So last year's gathering, our third annual in 2023, it was all about advocacy because I also have experience personally, and I think other members of our team, when we talk about advocacy with people that we meet, sometimes it's a little bit of a scary word. They feel like they have to be all in or do giant, big things, and that's not really always the case. And so at our gathering last year, we talked about what advocacy looks like. It can be big, grandiose gestures, or it's just truly having a conversation with your neighbor about lung cancer and lung cancer screening, or sharing your story. We know the shame and the stigma and the importance of humanizing lung cancer to reduce those things. And so just simply sharing your story and being vulnerable to talk about your experience as we build a network and a community for lung cancer survivors and their loved ones, and really anyone who has been impacted, is so important. And so we took what we learned at the gathering, all of these different things, and we created an End Lung Cancer Now advocate toolkit. Because again, it's a personal journey. You decide how you want to advocate. And so we created this toolkit, and it really, I call it a journey of self-reflection, really. We give examples of what others have done, but we just talk about, just talk to your neighbor, or just share your story, or make a post on social media, really whatever you're most comfortable with. And we also, so how you want to advocate is important to think about, but also what are you most interested in? Because your passion should really drive your work. Again, we want this to be joyful. And so doing something that you are passionate about makes it easy to remain joyful even when it's hard. And then also, to what level do you want to be engaged? Do you want to be on our advisory board, or do you just want to show up at community events and help staff our booths? Both of those things are incredibly important. We need everyone for those types of things. And so just thinking through what it looks like for you. And so we just hope that our toolkit and our resources really help guide conversations when people ask what they can do. We say a lot too internally: time, talent, or treasure. What do you want to share with us? What are you passionate about? There is a place for you. We're all in this together. And again, being able to build that network and that community. We do a patient-centric event each year. This year we hosted it on World Lung Cancer Day. And we brought together our community partners, others that are doing this work. We connected with patients. We talked with other healthcare team members here at the Cancer Center about lung cancer. We were in the Cancer Center, and I think we talked with more than 300 people throughout the day. And just from when I started 3 years ago, there was no support group for those impacted by lung cancer here at IU. And now there is, and our advocate engagement coordinator helps facilitate those. And our partnerships with the nurse navigation team, we've created educational materials for those newly diagnosed that we can share and answer their questions so they don't feel like they need to go to Google. Or again, everything is in lay language, easy to understand. We just want to be a resource, but we couldn't do all of that without our advocates and helping spread the message and making connections in the communities that we want to get in. So advocacy is really the heart and soul of what we do. Without people, we couldn't do it. And so there is a place for you. We hope that people will use that toolkit if they do want to get involved, just to generate ideas. No idea is too small and no idea is too big. And so I'm very proud of that too, just thinking through our army of advocates that we say that we've been building over the last couple of years. We have a great group, and I'm hoping that we can get some more over the next several years as well.
Yeah, and one of the things that I'm really proud of are the care kits that our patients get. We included in Lung Cancer Now blanket, which we say is like a big hug of support, and a lot of other great informational items and swag and just areas of support for people. And organizations really are about people. I think we've got a great vision and mission, and we've got great programs, but at the end of the day, and a great team, but you got to have great people, and advocates make it. They drive the message, they drive the work, they drive the energy and the opportunity and the creativity. And so if somebody is listening today and wants to join, wants to be an advocate, or wants to participate in any way that they're comfortable with, they can go to our website, endlungcancernow.iu.edu. Our advocate toolkit is there. If you want to support the organization, there's opportunity to support the organization there, or just information. If you just want to join our mailing list and get our connected newsletter, which has a lot of great information each month, I would certainly encourage people to do that. And you mentioned the advocate toolkit. I think you and I could just keep talking for the next hour. Our last gathering, which just happened a week and a half ago, focused on research, and we're going to develop a research toolkit from the patient's perspective, from the clinical operations perspective, from the researcher's perspective. We've got a lot of great ideas coming in 2025 to support and advocate for research. So stay tuned for that. The other thing that we absolutely cannot not talk about, and I know we have a lot of questions, and I'm happy to go through questions here too, but something we cannot not talk about is one of the most special things I've ever been associated with. And that comes from the generosity of the Tom and Julie Wood Family Foundation with an enormously generous gift to provide Indiana's first and only mobile lung screening program. MacKenzie, I know we're running a little short on time, but could you just spend a few minutes talking about what I think is going to be a game changer for rural Hoosiers?
Absolutely. So the mobile screening program, we will be screening our first patient in 2025, and we've been doing a lot of work behind the scenes over the last year since we announced this at last year's gathering. We established a task force to help us develop our roadmap, our plan. We have a great team solely dedicated to the mobile program. Amy, Josh, Danielle. I know there's a fourth team member coming on in early 2025. And we've done a lot of work looking at counties around the state, looking at smoking rates, incidence rates of lung cancer, death rates from lung cancer, who has lower access to screening facilities, and making sure that we are making decisions about where this mobile program is going. We will be traveling statewide and really trying to touch those counties who have high smoking rates and high incidence rates, but low access to care. And we are finalizing that route, and we will be able to share that soon. But as we think about our mobile screening program, we are thinking of this, again, as a public health initiative. People being screened on this mobile program, this might be one of few chances that they engage with the healthcare system. So making sure that we are equipped to connect them to social services or any additional resources that they might need, providing education, again, building that community as well. But we're very excited to start screening people on our mobile unit early next year, and looking forward to traveling around the state to serve Hoosiers who are at high risk, who have low access.
Yeah, and when I think about where the highest density of people with lung cancer live, it is in rural Indiana. And, right now, as you and I are speaking and people are listening in, there are thousands of rural Hoosiers who have lung cancer right now and don't know it. Most of them have stage 1 disease and don't know it. Thousands. And most are not going to get lung cancer screening if not for the effort of this mobile lung program. And the gift that the Tom and Julie Wood Family Foundation has provided will quite simply save rural Hoosiers' lives. And we're going to take that truck out there and we're going to screen those rural Hoosiers, and we're going to help them. We're going to help them so that they can spend more time with their families and see their grandkids grow up and go to Thanksgiving meals and go to weddings and see grandchildren being born and not suffering and dying prematurely from lung cancer. So that's what inspires me. It's what inspires the work. And I'm just so proud to be a part of it. And we're building a great team, and I can't wait to get started. And we will be doing that very shortly. So we are coming up against the time here. If people want to move on with their day, I totally understand, but I'm kind of having fun here. So maybe we can spend a few extra minutes, MacKenzie, in going through some questions that people have.
Yeah, absolutely. There was one that got submitted live. So if I can ask you this one first, and then we can kind of go through some questions that were pre-submitted. But going back to our point of, since anyone with lungs can get lung cancer, can you share what are the statistics regarding patients without a history of smoking or environmental exposure, or who are younger than age 50?
Yeah, it's a great question. So first, I want people to know that the vast majority of people who are diagnosed with lung cancer are not current smokers. They're either former or never smokers, but most people are not current smokers. Of course, there are a number of environmental factors which were alluded to in the question, but there are people who are in their 20s, 30s, 40s. My youngest patient was 19 who have lung cancer. And most frequently, they have mutations in one of a handful of key genes in their DNA. The most common is in a mutation called EGFR. When this gene gets mutated, it's like driving a car with an accelerator and no brake. The gene is uncontrolled and out of control. And the drugs that we have apply the brake to that gene's activity. There's another gene that's called ALK, and when that's altered, the same effect happens. Cells grow uncontrollably. This disproportionately happens in younger people, most commonly in those who are non-smokers, and disproportionately in women. The Asian population is also disproportionately affected by this. So we are beginning to learn more and more. There are a handful of other mutations, one in a gene called ROS1, one in a gene called RET, one in a gene called NTRK. I could go on, but we are beginning to discover these genetic alterations. Most of them are acquired mutations, but occasionally they are inherited. A small number of people do have what's called a germline mutation in EGFR, and I believe my 19-year-old likely did because her grandmother also died of lung cancer, was never a smoker.
Thank you. And along the same lines, when you talk about the gene mutations, how does personalized medicine and targeted therapies factor into the future treatment landscape for patients diagnosed with lung cancer?
Yeah, so lung cancer is the poster disease for understanding what we call molecularly targeted therapy with DNA alterations that are what we call druggable, that you can apply a drug. There's no other cancer that has as many what we call targetable DNA mutations as lung cancer. That's why I said earlier, underfunding lung cancer research is foolish. Because when you study lung cancer, you study cancer. You study the EGFR and the ALK and the ROS1 and the RET pathway. You understand P53. You understand KRAS. You understand tumor immunology, and you understand tumor microenvironment, and you understand DNA repair, and you understand the relationship between T cells and tumor cells. And so we have made huge advances. I would say that lung cancer is the poster child or poster disease for reducing the incidence through preventative measures. It's the disease in which the screening modality is the most effective at reducing mortality. It's the model disease for understanding molecularly targeted therapy and immunotherapy. And let me tell you, MacKenzie, when I started out 25 years ago, I could not believe that one day I'd be saying all those things.
Yeah, I feel like even since I've started in this role, the last 3 years, it's just been an evolution and lots of new advances just in the last 3 years.
Absolutely. Yeah, and when fellows and residents and students follow me in clinic, they're amazed at the patients that I'm seeing, and they're doing so well. But we got to keep up the work. Some people continue not to do well. And despite the advances, we got to push forward. And we got to push forward in therapeutics. And we got to push heavy in prevention, screening. But at the heart of all of this is advocacy. Advocacy drives everything else.
Yeah, I agree. I was going to close it out with one question that was pre-submitted. What would be your call to action for the audience today?
If you've been affected by lung cancer or cancer, and you want to do something about it, you want to be part of this cause, this movement, this effort, we need your help. And End Lung Cancer Now is the organization that I think you can work through to make your impact, to honor somebody perhaps you've lost, or to support somebody who is a survivor, or you just feel like you want to do something more to help this effort. So we need your help. If you go to endlungcancernow.iu.edu, it's all there for you. You can go click on our QR code for our advocate toolkit and figure out how you can help. You can email myself or MacKenzie. We sure would appreciate all the help and support. And if you just want to, provide financial support, we promise to use those dollars to expand our efforts.
Thank you. Thanks,
MacKenzie. I really enjoyed this conversation, and I appreciate the Simon Cancer Center sponsoring this. And this was truly interesting for me. November is Lung Cancer Awareness Month, but I want everybody to be aware year round. So I hope to talk to everyone again real soon.